Talking about safe patient handling using mechanical lift, the National Institute of Occupational Safety and Health recommends that 35 pounds be the maximum limit that a single clinician use during a lift. Now that becomes important because as clinicians we'll always be asking for help to work smarter, not harder, and take less strain off of our body, which of course is also the goal of using a mechanical lift rather than manual. Now, during the whole process, it is important that communication is there between you and your patient. Communication is the foundation of trust and rapport with the patient, so it's important that they understand each step along the process of the transfer. That'll ensure that they are comfortable and they understand their responsibility throughout the transfer as well. Now, first and most important thing, of course, you want to make sure you have the correct sling, and that includes the correct size and the correct weight limit as well. And then the placement of the sling, you want to make sure is comfortably underneath the patient. But before you place that, you want to make sure you have a clean environment, so a clean path from the bed straight to the wheelchair. You want to make sure the wheels are locked on both the bed and the wheelchair as well to avoid any kind of stumbling and prevent the patient from being put in any kind of risk of harm. So to place the harness up underneath the patient, the other clinician assisting will roll the patient onto one side while you roll up the harness halfway, and you tuck it up underneath the patient as far as you can, rolling the patient to the other side. The other clinician will pull the other side of the harness tight. That way it's nice and comfortable and ready for transfer. The top of the harness will be just above the head for comfortable head support. Bottom of the harness will be just above the knees. And then you'll roll over the mechanical lift so the crossbar is just above the patient. You'll go ahead and take the straps, put the straps on the hooks on the crossbar, lifting the mechanical lift to where the straps are tight. Do a quick safety check, ensure that the path is clear, and then go ahead and lift the patient a few inches off the bed. And then moving the patient over to the chair, one clinician will be supporting the patient and the other clinician will be moving the mechanical lift, bringing them over to the wheelchair, and then lowering the patient nice and slow into the wheelchair into a comfortable position. You may have to reassess the position after taking the straps off and readjust their hips back into the back of the chair. And then of course you want to make sure that you leave them a way to call for help in case needed, and make sure they are comfortable for their next step in their process.